Chamber of Commerce breakfast. Join the Chamber for a morning of insight with guest speaker Laura Graneman, with the whole event emceed by Fox 2 News anchor Roop Raj. Join your local businesses at the Wabi Country Club September 13th at 8:30 a.m. Order your tickets by September 6th at westbloomfieldchamber.com/breakfast. We'll see you there.
Let's whoop it up for these moments, made possible by the COVID-19 vaccine. Keep the cheering going by keeping yourself protected and your COVID-19 vaccines up to date. In the face of COVID-19, staying healthy is important. And now the same is true as we face the flu. Influenza has the potential to infect millions, putting lives and the healthcare system at risk. Fortunately, it's easy to protect yourself. The flu vaccine is safe and effective, and with COVID-19 still spreading, it's essential. To see how you can hit this virus head on, visit michigan.gov/flu. Now that the vaccine is available for children 5 and up, why do you recommend it?
Kids are part of the community and they can spread COVID.
We're seeing both healthy children getting sick from the virus as well as children with underlying health conditions.
They can easily bring the virus home to other people that are vulnerable and make them sick as well.
This vaccine can change that and keep children safe.
It's essential that your children get vaccinated to protect them, to protect your families, and to protect those in the community around you.
You're listening to 89.3 WBLD Orchard Lake and 88.1 WBFH Bloomfield Hills. Today's edition of the Megacast begins now. Welcome to the Megacast. I'm Tyler Keith, welcoming you to our live, local, 5 days a week look into all things Michigan. Today, we'll be talking about a whole host of fun and interesting stuff and important news stories here in Michigan. Let's get into today's headlines on our website at civiccentertv.com. On our local news page, our top story today comes from George Hunter at the Detroit News as protesters spoke their minds to DTE Energy in downtown Detroit on Monday, raising frustrations with proposed rate hikes. Signage included saying, quote, "Stop the rate hike," and quote, "DTE can't silence me," and closed quote. Following the protests, some members of the group proceeded to make comment on the issue at the Michigan Public Service Commission's hearing that also was discussing this matter further as well. DTE has set a goal to implement the proposed rate hike by November of this year, charging residents an extra $10 per month on their regular bills. And that is where the frustration comes from. So that full story, much more detail about what the protesters got into and as far as what they were saying, some of the comments they made to the Michigan Public Service Commission, and where the proposed rate hikes are at from DTE and how that might affect your bill. That article, civiccentertv.com, on our local news page. Also making headlines there from John Osting at Bridge, Michigan. There's some competition in the Michigan GOP regarding their lieutenant governor nomination after Tudor Dixon named former state representative Shane Hernandez as her running mate last week. Former gubernatorial candidate Ralph Rebant, who lost in the primary election to Tudor Dixon, confirmed that he intends to seek the nomination for lieutenant governor by the Michigan GOP at their convention on Saturday. That has not kept the bigwigs from getting involved. However, as former Republican President Donald Trump has put his full support behind both Dixon and Hernandez. In a statement, Trump said, quote, "This is who Tudor wants, and therefore Shane is who I want as your next lieutenant governor. The radical left Democrats and fake news media demand that Republicans be divided. We must work together to defeat them, and in particular, Gretchen Whitmer," and closed quote. With that, all eyes certainly now on the lieutenant governor race at this weekend's GOP convention for the state of Michigan. Other nominations will also be made official at that convention this week, Saturday, and that will, of course, affect your ballots in November. Finally, making headlines today on civiccentertv.com's local news page from Frank Witzel at the Detroit Free Press. Even as gas prices continue to drop, and they're looking like they're going to continue to drop, that doesn't mean that we're going to have any less people on the road. In fact, we're going to have more people on the road, and not just drivers. Drivers are urged that this means they need to be extra vigilant when out on the roads. With back to school in full swing, groups such as AAA are urging residents to remain vigilant on all the roads in their neighborhoods and beyond, as foot traffic will be much higher than in past school years, with kids for the most part being fully in person for the first time in several years for what hopefully will be the entirety of this school year. So watch out, be safe, and remember, we are all sharing the roads. As for what you get at the pump, according to AAA, the most expensive average gas prices throughout the state currently stand at $4.15 a gallon in Traverse City, $4.04 per gallon in Ann Arbor, and $4.02 per gallon in Marquette. So those upper lower peninsula as well as up north cities definitely affected by that, as well as Ann Arbor. The least expensive gas in Michigan right now is in Flint, $3.75 per gallon on average. Also in Saginaw and mid-Michigan at $3.77 per gallon, and Grand Rapids at $3.78 per gallon. All of those headlines making news today on our website, civiccentertv.com, on our local news page, as well as those helpful links to accurate and up-to-date information on COVID-19 from the Centers for Disease Control and Prevention at the federal level, the Michigan Department of Health and Human Services, as well as the Oakland County Health Division. We have a great program ahead on this Tuesday edition of the Megacast. Up next, we'll talk COVID-19, monkeypox, and other public health issues with Dr. Russell Faust from the Oakland County Health Division. This is the Megacast.
Connect with local leaders, philanthropists, and more. The Greater West Bloomfield Chamber of Commerce presents the 2022 Leadership Breakfast. Join the Chamber for a morning of insight with guest speaker Laura Graneman, with the whole event emceed by Fox 2 News anchor Roop Raj. Join your local businesses at the Wabeat Country Club September 13th at 8:30 a.m. Order your tickets by September 6th at westbloomfieldchamber.com/breakfast. We'll see you there.
Let's whoop it up for these moments, made possible by the COVID-19 vaccine. Keep the cheering going by keeping yourself protected and your COVID-19 vaccines up to date. In the face of COVID-19, staying healthy is important. And now the same is true as we face the flu. Influenza has the potential to infect millions, putting lives and the healthcare system at risk. Fortunately, it's easy to protect yourself. The flu vaccine is safe and effective, and with COVID-19 still spreading, it's essential. To see how you can hit this virus head on, visit michigan.gov/flu. Now that the vaccine is available for children 5 and up, why do you recommend it?
Kids are part of the community and they can spread COVID.
We're seeing both healthy children getting sick from the virus as well as children with underlying health conditions.
They can easily bring the virus home to other people that are vulnerable and make them sick as well.
This vaccine can change that and keep children safe.
It's essential that your children get vaccinated to protect them, to protect your families, and to protect those in the community around you.
Welcome back to the Megacast, our live daily 1-hour TV, radio, and streaming show about all things Michigan. I'm Tyler Keefe. Learn more about the program by visiting civiccentertv.com/megacast, where you'll find information on our entire network of stations, including My Michigan TV. Joining us now on the Megacast is the Chief Medical Director for the Oakland County Health Division, Dr. Russell Faust, with us on the Megacast. Dr. Faust, thanks for being with us again.
My pleasure. Good morning. Nice to see you again.
Good to see you as well. Appreciate having you on. So we usually will be talking about COVID-19. There's plenty of other issues to talk about. But before we do that, let's get an update on where we stand with COVID-19 in the state of Michigan, but in particular in Oakland County. The last time we spoke, we were talking about the BA.5 subvariant and its ability to kind of bounce around the vaccine and around some of the booster shots, at least at that time. As far as where we're at right now, what in terms of further booster shots are being developed that may be able to better combat the BA.5 subvariant, if any?
Well, I can only really speculate. CDC and FDA are being pretty closed about details. We know that the pharmaceutical companies are currently developing boosters for BA.4, BA.5. We are being told through MDHHS, Michigan Department of Health and Human Services, that we should be pre-ordering those boosters shortly, so in September. But we really still don't have a timeline, and we really still don't have a notion of whether those will be strictly boosters or new vaccines. On that topic, I do get regular questions from people who are eligible for a booster or their second booster, asking me whether they should just wait for this BA4, BA5 variant booster coming up, hoping that will be all they need. And the fact is, immunity response from the existing vaccine and existing boosters are still helpful in preventing severe infection and complications from the Omicron BA4, BA5 variants. So the fact is, if you're eligible to get boosters, you should absolutely do it now while you can. Maximize your immune response to prevent those severe complications, and then get the new BA5 booster when it becomes available.
Dr. Faust, the last time we spoke, we brought up the topic of monkeypox, and at the time, it wasn't really much of a large concern for Oakland County in specific, or even for the state of Michigan. Since then, cases did pop up in Michigan, beginning in Oakland County with the first recorded case in the state of Michigan. And Oakland County, in fact, later on, just a few weeks later, had created a new task force specifically to combat monkeypox in Oakland County. Can you give us a status report on where the monkeypox task force has gone, what work has been done in that group in terms of reacting to the spread of monkeypox across the globe, and in particular, how it affects Oakland County?
Great questions. Let me just quickly review the data on monkeypox. There are more than 43,000 cases globally at this time, 15,433 as of this morning in the United States, 138 cases across Michigan, and 23 cases here in Oakland County. You are correct. The first confirmed case in Michigan was in Oakland County. I hate to say it's not a concern. It's a concern in certain populations. The fact is, monkeypox virus is spreading mostly through close, intimate contact with someone who has monkeypox. You can take steps to prevent getting monkeypox by avoiding close skin-to-skin contact with the monkeypox rash, washing your hands often, especially after contact with someone who's sick. Now, following the recommended prevention steps, getting vaccinated if you are exposed to monkeypox, or if you are in a higher risk group to be exposed to monkeypox, can help protect you, your family, your community. Let's talk about, go ahead.
So when the monkeypox task force was initially formed, they did
Yep.
talk about vaccines. The difference between this situation with monkeypox versus COVID-19 is COVID-19 is a novel virus. We've known about monkeypox. There are vaccines available for monkeypox, but the issue had been at the time of the forming of the task force that there wasn't enough vaccine for any sort of widespread distribution in Oakland County or even in the state
Let's
of
talk about
Michigan.
why that is.
Sure,
The fact
please.
is, the monkeypox belongs to the whole family of viruses that include smallpox, the variola virus. Okay, it is not smallpox. It is not chickenpox, but it is related to smallpox. We have never had a monkeypox issue in the United States. In fact, of those 43,000 cases globally, those are across 95 countries, 88 of which have never had monkeypox. So this is a new mutation. Fortunately, it's a DNA virus that does not mutate as rapidly as, for example, influenza or COVID-19. But because it is related to smallpox, the vaccine was originally devised against smallpox. That means in the United States, it's part of the national strategic stockpile intended primarily for our military, who would potentially be exposed to a smallpox potential bioweapon. So we're having to draw nationally, we're having to draw on those strategic stockpiles for a traditionally created, developed vaccine to vaccinate the communities that are at risk. So unlike the mRNA vaccines, this is one of the advantages of the COVID-19 vaccine. It's an mRNA vaccine. It's basically rapid and inexpensive to develop. And as a make the new BA4, BA5 variant. They take out the cartridge for the original and insert the cartridge, the sequence for the new spike protein variants. That's not possible. So to ramp up production of this monkeypox or smallpox vaccine, Jynneos, is going to take a while. So that is happening right now. One of the ways to stretch our sources of monkeypox vaccine is to, instead of injecting it subcutaneous, we're injecting it, according to CDC and MDHHS, intradermally. And the intradermal means there's not a great blood supply there. So the injection lasts longer, gives it a longer chance of our immune cells to ramp up a response. There are a lot of immune cells in your skin, and we're able to stretch it 5-fold. So instead of half a milliliter, it's 0.1 milliliter per intradermal injection. So that's what's happening now. We're also being promised, and we continue to receive allocations of the smallpox or monkeypox vaccine. With regard to the, well, that's gone. Go ahead.
In terms of availability for those that are at risk or are in higher risk groups for contracting monkeypox, what is that availability in Oakland County? Who is eligible at this time for vaccination?
So basically, number one are those who are exposed. And there are people who, as we do contact investigations, case investigations, and contact tracing, those who have been exposed are eligible to start the two injection series for the monkeypox vaccine. The task force has identified a number of clinics in our county, a couple that they regularly are seeing the majority of people who have had exposures. And there have been exposures outside of the state, which complicates kind of the case investigation and contact tracing, of course. You know, they're long distance calls. Many of those contacts are not only direct skin to skin, but potentially clothing, towels, for example, that someone with the monkeypox has used, that are used by someone else around the pool party, that kind of thing. So those contacts are potentially anonymous and makes it extremely challenging to do the contact tracing and advise those folks on getting vaccinated. But we are supplying vaccine right now. I wish I had a number to give you. I do not on the numbers that have been vaccinated in Oakland County, but we're doing well at controlling this here.
We're joined by Dr. Russell Faust. He's the medical director with the Oakland County Health Division, joining us on today's Megacast. More information can be found on oakgov.com. That's oakgov.com for more information from the Oakland County Health Division on monkeypox, on COVID-19, and more. Dr. Faust, also what's been making news nationally has been a sort of resurgence, especially in comparison to numbers from past several decades, of polio nationwide. Primarily, it started popping up over the last few months in New York City, in that general area. But Michigan recently, the reports have said that Michigan is on quote unquote high alert for this, as the primary childhood vaccine series, the vaccination rate fell by 6.9% down to 67.1% statewide. How much of a concern is there with those rates continuing to drop of people getting their children the primary childhood vaccine series, which includes polio, measles, tetanus, whooping cough, hepatitis, and pneumonia, that this could spread some of these viruses and these other illnesses that had previously, if not been eradicated, had been very, very rare among children in particular?
Yeah, I appreciate that. We're very sensitive to this issue. Let's talk a little bit about polio and the history of it. I'm old enough to have been vaccinated for polio just after that vaccine was developed or invented by Jonas Salk, 1955. Thanks to a successful vaccination program, most people in the U.S. are protected from polio. However, people who are not vaccinated or who haven't received all the recommended doses can be at risk. We have eliminated polio in the United States, and we did so back in the late 70s. that doesn't mean polio can't come in from other countries that are not fully vaccinated. So we eradicated here in the United States, North America, and this is what occurred in New York. Now, we use an inactivated polio virus for our vaccine here for polio, inactivated. There are reasons that that's difficult to use around the world, things like refrigeration and transportation. So there's an oral polio virus that is used that is not inactivated. It's a live mutated virus. And if someone who's completely unvaccinated is exposed to someone who has received that oral polio virus, they can potentially become infected with polio. Now, here's the worry, the scary aspect of this. Before our vaccines were developed in the 50s, at least 15,000 people annually were paralyzed from becoming infected with polio. That's about a 1% paralysis rate. And we, I remember those people, walking with crutches or being in the so-called iron lung before we had ventilators. We don't want to go back there. The challenge we're facing right now is that because of some backlash against the COVID-19 vaccines, and because we've had shutdowns and reduced ease of access to, say, pediatric offices, our vaccination rate has really plummeted, and specifically in certain pockets of our community. That reduction of 7% to 60 whatever percent, that's an average, a general statistic. But there are pockets in our community that are essentially unvaccinated for polio. And this is a concern. The patient that appeared with polio in New York was in Rockland. And there is an interesting connection between Rockland, New York, and Oakland County. And that connection is based on our previous measles outbreak of 2 or 3 years ago. And so we are sensitive and alert and monitoring right now and doing the best we can to possibly get everybody vaccinated, not only against polio, but for all the other infections that have seen reduced vaccination over the last 2 years.
Again, that metric, 6.9% down since July of 2019 as of June of this year. In terms of numbers in Michigan for those that have received the primary childhood vaccine series. We're joined by Dr. Russell Faust on the Megacast. Dr. Faust, just another couple minutes with you before we'll need to say goodbye today. Any other information at this time from the Oakland County Health Division that they would like residents to be keeping in mind or keep aware of as we go into the future?
Folks still have access to COVID test kits. And in fact, that access, that eligibility has been expanding. I know early on, there were many zip codes that just were not eligible. I urge folks to go to accesscovidtest.org and put in their zip code, see whether they can get free COVID tests. I think it's a great thing to do. I urge people to get vaccinated. Get your vaccinations up to date. Do not risk you or your family to become infected with polio or any of the other debilitating diseases. And that includes influenza. So get your flu shot. Co-infection with COVID and influenza increases your fatality risk by more than 6-fold over your infection with either one of those alone. Thanks so much, Tyler.
oakgov.com/health for more information from the Oakland County Health Division. Appreciate it, Dr. Faust.
Thank you.
oakgov.com/health again for the COVID-19 at-home testing kits. That the website that Dr. Faust gave was accesscovidtests.org. We'll take a break on the Megacast. On the other side, when we return, we'll continue on with the program and we will be speaking with Joan Barrett from the Lakes Area Community Coalition. This is the Megacast.
Now that the vaccine is available for children 5 and up, why do you recommend it?
Kids are part of the community and they can spread COVID.
We're seeing both healthy children getting sick from the virus as well as children with underlying health conditions.
They can easily bring the virus home to other people that are vulnerable and make them sick as well.
This vaccine can change that and keep children safe.
It's essential that your children get vaccinated to protect them, to protect your families, and to protect those in the community around you.
Let's relish these moments, made possible by the COVID-19 vaccine. Keep the festivals going by keeping yourself protected and your COVID-19 vaccines up to date. Can I ask you a question? Why do you want to get the COVID-19 vaccine?
I don't like getting sick. The virus will die. It will be easy to not catch it. Keep my family safe and keep playing soccer. Because I love being vaccinated.
What's your hope for everyone?
I hope everybody gets the vaccine to keep safe and strong. Be like happy, having fun everywhere. Everyone stay safe and hope you get the vaccine. I'm feeling good.
Let's savor these moments, made possible by the COVID-19 vaccine. Keep the dining out going by keeping yourself protected and your COVID-19 vaccines up to date.
Welcome back to the Megacast, our live daily 1-hour show about all things Michigan. I'm Tyler Keith. Learn more about the program by visiting civiccentertv.com/megacast, where you'll find information on our entire network of stations, including My Michigan TV. Joining us now on the Megacast is Joan Barrett. She's the executive director of the Lakes Area Community Coalition. Joan, thanks for being with us today.
Hi, Tyler. Thanks for having me on.
Appreciate having you on. So first off, if you can just give us an introduction to the Lakes Area Community Coalition and some of the work that you do in Lower Michigan.
Sure, you bet. We are a nonprofit focused on preventing youth substance use and addiction. We serve the Lakes area, which is really the boundaries of Walled Lake Consolidated School District. We serve the communities of Wixom, Walled Lake, Wolverine Lake, and Commerce Township. And we are focused, as I said, on preventing youth substance use, which leads to addiction. We know that when kids try drugs and alcohol early on, they are more likely to become addicted. So we work on preventing the onset of substance use in young people. And then we work on providing supports, building protective factors around kids so that they're less likely to turn to drugs and alcohol as a means of support. We work on building protective factors around kids so they have other alternatives and other healthy things to do with their lives, and they can live healthy, thriving lives as adults in our community.
So we've talked so much over the course of the COVID-19 pandemic about the ways that the pandemic and the stressors that arise from it have affected drug and alcohol use and misuse among the adult population. How has that affected our younger population, our children and our teens in particular?
It's really interesting. COVID definitely had a huge impact in kind of two different dimensions. What we've seen from our data, both locally that we've collected and county and national wide as well, in some ways, substance use and use went down. Alcohol use is down primarily because it was a social activity that kids were doing in groups. And when kids weren't gathering in groups to use alcohol with their friends, similarly vaping as a social activity in the schools, we saw those numbers trending down. Now that we are opened back up, those numbers we expect will kind of tick back up as kids are back in those social situations. So we want to encourage kids in social situations to not depend on drugs and alcohol, or not use that as an activity that they're doing with friends, find other healthier activities. The other thing that we've seen, though, is kids who experience more mental health challenges during the pandemic and isolation were more likely, in some cases, to access drugs in their home, access alcohol, cannabis, prescription medications in their home, and misuse those while they were in isolation and while they were dealing with serious mental health concerns. So one of our education pieces we've been working on with families is to secure all cannabis products, all alcohol in the home, so the kids can't get to it. Likewise, prescription medications should be monitored and kept secure in the home where children are and where teens and young adults are.
We're joined by Joan Barrett, the Executive Director of the Lakes Area Community Coalition on the Megacast. More information can be found on lakesareacc.org, lakesareacc.org. To get involved and find some more information, give us some oversight, an overview on what sort of resources are available through your organization for parents that may be concerned about their kids, or for kids that may have realize that they've developed an issue with some of these different substances and want to take some steps themselves.
Yeah, our website, lakesareacc.org, is really a great starting point for resources, both for families, for kids. We have a resources tab at the top of the website, and in it, parents will find, and young people will find, a whole panel of different topics. You can find information about each substance. There's a tab that really will give parents some information about, I'm concerned about my child, I don't know what to do next. There are some great web resources that we have on there. Additionally, we offer, as a coalition, we offer 2 different support groups. One for young people online on Thursday nights. It's a Smart Recovery. The name Smart Recovery is a little bit deceiving. It's really for young people who are experiencing any addictive behaviors and would like some support in coping with cravings and urges, behaviors that they think are not their best choice. So it's a youth support group for young people only, 14 to 18. And that meets virtually on Thursday nights. We also offer an adult support group through our partnership with our faith community in the Lakes area. And it is called Hope. And it meets on Thursday nights at the Market Street Church Community Center in Walled Lake. And that has been a great, support group for parents or for adults that have dealt with issues or would like some support around substance use in their family. We are a prevention organization. We're not a treatment. So these are support groups only, and they're a great way for people struggling with issues to connect and find mutual support and find resources elsewhere in the community. But our mission is really focused on the prevention side before we get to the place of needing that support. How can we, really wrap around our kids and have healthy communities from the outset?
lakesareacc.org is their website. For more information, we're joined by the Executive Director of the Lakes Area Community Coalition, Joan Barrett, on the Megacast. You have an event coming up in September. It's called Make a Move. It's a 5K trail ride. Tell us about this event and what is the goal coming out of this event in terms of what your organization wants to accomplish because of Make a Move.
Yeah, you bet. We're really excited about this event this year for a couple different reasons. For the last 2 years, we hosted just the trail ride on the Michigan Airline Trail, which was new to our community. And it actually was a great event to do during pandemic. We were outside, we had the whole trail to use, and it was wonderful. This year, we are continuing the trail ride as an option, and you can register for the trail ride, but you can also register for a 5K if you'd like to do a run or a walk 5K. That will be within the city of Wixom city limits, but starting at the trail at the same point. And we are partnering this year with the Wixom Downtown Development Authority and the city of Wixom in partnership with their Block Party, which is an annual event that they host downtown. So yes, this event is on Saturday, September 10th. That's just over 2 weeks out. And our event starts about 10:30. We're going to have a warm-up activity. We're going to have some speakers in recovery, kind of remind us why prevention is so important. And those stories of recovery inspire us to work hard for prevention in the community. Then we will get our trail ride, our 10-mile trail ride riders started and off on the trail right around 11:15. Our 5K will start at 11:30. As people are coming back to Sibley Park, where we are starting and ending, we will be offering a free Narcan training for anyone in the community. Narcan or naloxone is an intranasal overdose reversal drug that is great to have out in the community. We know with the opioid epidemic, and we know with so much fentanyl polluting the prescription drugs on the black market, we know that having access to life-saving medication like naloxone will save lives. So we're going to do a free Narcan training. Anyone is welcome to participate in that. It's only about 15 minutes, and you leave with a Narcan kit. And then we will hand out our awards and our raffle prizes for all of our participants. About 12:30, we'll do another naloxone training at 12:45. And then the block party continues on until 5 p.m. There will be music on 2 stages, one where we are after our event is done, and one on the west end of the downtown area. There will be games, there will be face painting and activities for kids, lots of stuff going on downtown. So we're excited to sort of kick off the block party and partner with the Downtown Development Authority and hopefully bring awareness and a really positive, healthy activity to the greater Lakes area.
Well, Joan, we appreciate having you on. We have a couple more minutes with you before we'll need to say goodbye. I want to give you an opportunity to talk about some of the ways kids can get involved, particularly with your Youth Action Board.
Yeah, we host a youth coalition or a youth group that we really seek to develop positive student leaders from the Walled Lake School District. It is open to any young person in middle or high school in any of our Walled Lake schools or any of the parochial or private schools in the nearby area. And we meet monthly out in the community. We partner with another nonprofit, Words of Hope for Life, and we use their space, which is called The Rail, and it's in downtown. It's on Maple Road, just to the east of downtown Walled Lake. And we meet out there, and then we do lots of things around messaging from youth for youth. So getting kids to identify ways in which they might be positive peer influences. They have an Instagram feed that they curate constantly with messaging to peers. They're working on a podcast this year to really get some good information, reliable information from kids to kids. And the adults sort of guide their work, but we also really listen to what they are saying. And they really are the ones who know the challenges kids are facing and the access points kids have to substances. So the adults in the coalition really rely on our youth leaders. So if you know of any young people in the Lakes area that would like to be involved, our website, again, lakesareacc.org, has a youth tab. And Nikki is our Youth Action Board leader. You can text her for more information anytime, and her number is on the website. So we love to empower kids to be leaders in their schools, and we need them to inform the work of the adults that hopefully can have a positive influence on shaping their lives.
Well, Judy, we appreciate your time. Thank you so much for being on the show, Joan.
You are welcome. Thanks so much for having me.
Been joined by Joan Barrett, the Executive Director of Lakes Area Community Coalition on the Megacast. More information can be found on their website, lakesareacc.org. We'll take a break on the Megacast. When we come back, how one local health organization is partnering with a local university to increase the number of graduating nurses in Oakland County. This is the Megacast.
Connect with local leaders, philanthropists, and more. The Greater West Bloomfield Chamber of Commerce presents the 2022 Leadership Breakfast. Join the Chamber for a morning of insight with guest speaker Laura Graneman, with the whole event emceed by Fox 2 News anchor Roop Raj. Join your local businesses at the Wabeat Country Club September 13th at 8:30 a.m. Order your tickets by September 6th at westbloomfieldchamber.com/breakfast. We'll see you there.
Let's whoop it up for these moments, made possible by the COVID-19 vaccine. Keep the cheering going by keeping yourself protected and your COVID-19 vaccines up to date. In the face of COVID-19, staying healthy is important. And now the same is true as we face the flu. Influenza has the potential to infect millions, putting lives and the healthcare system at risk. Fortunately, it's easy to protect yourself. The flu vaccine is safe and effective, and with COVID-19 still spreading, it's essential. To see how you can hit this virus head on, visit michigan.gov/flu. Now that the vaccine is available for children 5 and up, why do you recommend it?
Kids are part of the community and they can spread COVID.
We're seeing both healthy children getting sick from the virus as well as children with underlying health conditions.
They can easily bring the virus home to other people that are vulnerable and make them sick as well.
This vaccine can change that and keep children safe.
It's essential that your children get vaccinated to protect them, to protect your families, and to protect those in the community around you.
Let's relish these moments, made possible by the COVID-19 vaccine. Keep the festivals going by keeping yourself protected and your COVID-19 vaccines up to date.
Welcome back to the Megacast, our live daily 1-hour show about all things Michigan. I'm Tyler Keefe. Learn more about the program by visiting civiccentertv.com/megacast, where you'll find information on our entire network of stations, including My Michigan TV. Joining us now on the Megacast are two individuals who are working together, as well as their institutions, to provide more nurses in our local area, as we have seen a bit of a nursing shortage across the board here in Michigan and around the U.S. over the last couple of years as a result of COVID-19, as well as other factors in the industry. Joining us now is Judy Didion, Dean of the School of Nursing at Oakland University, and Ann Stewart, Vice President and Chief Nursing Officer at Beaumont Health and Spectrum Health on the Megacast. Thank you both for being with us today.
Thank you. Glad to be here.
Appreciate having you both on. So let's start with you, Judy, as your institution as Oakland University has partnered with Beaumont Health and Spectrum Health on this issue. And in terms of getting students not only to go into nursing, but also to graduate from nursing programs, how important is it to have this partnership with a major local health institution to help them not only get into these programs more in depth, but have career opportunities, knowing they have career opportunities on the other side as they prepare to graduate from Oakland University?
Well, I want to thank you first of all, for inviting us to talk, but it's essential. Our having students have a pathway to move through their education, to be supported through their education, and to have an opportunity for employment is essential as we work with this nursing shortage. Individuals out there that want to move into healthcare, want to be registered nurses, really want to know how to get there. And I think this partnership with major academic center is very important for us to provide this for our students, because we cannot educate registered nurses without their help. So I really appreciate our partnership and Ann's collegial work with us as we move through this new initiative.
In terms of the nursing workforce shortages, and how will this partnership with Oakland University help your institution bring more nurses in and provide support to those nurses that are already in your health system and in the industry that are feeling stressed because of the shortages?
Tyler, also, I thank you for having us. This nursing shortage certainly has been something we kind of waited for, and then it kind of hit us like a Mack truck. And what we need to do is think differently on how we bring nurses to the bedside. So this partnership allows us to help our students through their schooling. And then we commit ourselves not only to giving them the clinicals they need through those couple of years of nursing school. With 8 hospitals, we have a variety of different specialties and different hospitals they can go to. And then we will help them on their career path for those first 2 years, committed to making them an excellent Beaumont nurse as our other Beaumont nurses are.
I'm by Judy Didion, the Dean of the School of Nursing at Oakland University, as well as Ann Stewart, the Vice President and Chief Nursing Officer at Beaumont Health and Spectrum Health on the Megacast, as Beaumont and Oakland University announced recently a $20 million nursing investment for the program at Oakland University and for career paths leading to Beaumont and Spectrum Health. And they both join us on the Megacast at this time. And so, Judy, for Oakland University, how does this partnership benefit your program, the prestige of your program, but also the development of your nursing program at Oakland University to make it more competitive for students coming in and a higher quality education for those that are already in and will be coming into Oakland in the future?
Well, with part of this gift is an expansion of our current enrollment. And in order to expand our current enrollment, we do need more clinical spaces, which Beaumont will allow us to have for those students to educate in the live healthcare setting with patients. But we also needed to expand our lab. Our lab is very critical for our students to learn skills, to work through simulation, to really develop their critical thinking skills, understand how to interact with the patients at the bedside in a setting that's very safe. And so this infrastructure that we'll build will allow us to expand our lab, which will help us to add the number of students in our enrollment. It will also support us in terms of faculty. One of the reasons for the nursing shortage is lack of faculty and clinical resources. So we're really focusing in with this gift on alleviating both of those barriers. So for us at Oakland, this gift, not only does it provide financial support for the students who will enroll in the program, but it will also allow us to build an infrastructure that we can hopefully sustain and continue to have additional students enrolled in our programs, which allows us to graduate more new nurses in the workplace.
And then, Anne, for you on your side, it's one thing for an organization like yours to partner with a university and provide some insight into programs or additional career path opportunities or discussions with the students. It's another thing to invest faculty into Oakland University's programs, to make the financial investment that you did and the resource investment that Beaumont has into this program. For your organization, why make those great of steps to support a program like the nursing program at Oakland University? How does that overall benefit the future of Beaumont and Spectrum Health?
So as we have mentioned, there is a nursing shortage and we have to look at things differently. And this partnership really, over the next 5 years, we'll have 500 additional nurses that will be at the bedside caring for patients. And that is the ultimate goal. We need more nurses at our bedside. And this is an opportunity for the nursing students and the nurses to work together and really be able to care safely and compassionately for our patients.
So why Oakland University, from your organization's standpoint? Why that partnership with this university at this time among all the options that are out there? What about Oakland University made that the perfect institution for Beaumont Health and Spectrum Health to partner with in this effort?
Sure, I can give you just a general reason. Oakland University has been a great partner for us. We are, geographically close. So many of our nurses have already been going to Oakland. I have 2 of my degrees through Oakland University. It is our community. Yeah, it's within our community, and it has just always been a great partnership. And this just really enhances that partnership.
We're joined by Ann Stewart, Vice President and Chief Nursing Officer at Beaumont Health and Spectrum Health, as well as Judy Didion, the Dean of the School of Nursing at Oakland University, on the Megacast. Judy, you mentioned earlier on some of the further investments in faculty and resource availability for Oakland's nursing program, but also part of this investment from Beaumont and Spectrum Health into your programs will include infrastructure. What sort of infrastructure changes or programs will be implemented for the nursing program at Oakland University as a result of this partnership with Beaumont and Spectrum?
Well, in order to add 500 students over the next 5 years, we really needed to build our lab, which I spoke about earlier. We're going to expand our simulation lab, add 3 simulation rooms, which really is cutting edge, but it's also important for our students to have that ability to work through simulation in clinical problem solving and critical thinking, so that when they move into the healthcare system as students, they're much more prepared to work with human beings and also provide safe and quality care, because that's essential. So lab will be one aspect. The other is hiring additional faculty. We will need to have more classroom space and more classroom sections, which will require more faculty, as well as clinical faculty, because when we send our students into the hospital, it is a 1 faculty to 8 student ratio. So with these additional students, we'll need to hire more faculty in terms of providing that education. And then, of course, we'll need to recruit faculty and work with Beaumont in terms of where they would like to emphasize that recruitment, because they have numerous healthcare facilities that have different shortage issues. So we will work closely with Beaumont and collaborate with them in terms of their priorities of where they need to fill this shortage. And with that, we'll be marketing to those areas. So we will hire a recruiter who will also do advising for these students and help support them along the way. There's one thing about recruiting students in, but we also need to provide all the wraparound services to support their success, because ultimately we want them to graduate, pass their board, to become a registered nurse, and then move into the workplace as smoothly as possible.
Judy, also earmarked in these investments are some funds for student scholarships as well. Can you speak about some of the additional scholarship funds that will be available to students as a result of this partnership?
Yes, half of the gift, $10 million, is geared towards student scholarships. And what we will have to plan out is how much scholarship per student. So if we want to expand our program with 500 students, that kind of, with the math, that kind of tells you about how much, possibly $20,000. Now, some students come in with additional scholarships, so we will kind of work with those students so that we can offset some of those scholarships and reduce any kind of burden that they might, have or potentially have to continue, to complete their education. So I can't say each student will get a certain amount, because it all depends on what other kinds of scholarships they're coming in with at the time. So, but we will use all of that money to fund student scholarships. And I think this is really important for nursing, because nurses coming out with student loans makes it tough for them. So having this gift really will not only recruit students that may not have thought they could afford to go to nursing school, but I think it will also provide them the comfort that they need in terms of moving into their first employment and not worrying about those loans.
Judy, Ann, appreciate both of your time and for telling us more about this great new partnership that will support so many nursing students here in the Oakland County area, and certainly many future nurses in Oakland County and throughout southeastern Michigan. Appreciate it.
Thank you.
Oakland.edu for more information on nursing programs at Oakland University, as well as other programs throughout the university altogether. That'll do it for today's edition of the Megacast. You can find all of our programs live and on demand on civiccentertv.com. Go over to civiccentertv.com/megacast to find more information on all of our partnering TV, radio, and web outlets across Oakland County and around the state of Michigan. You can also, on our Megacast page, find our full shows and each individual interview on demand as well. civiccentertv.com/megacast. For up-to-date and accurate information on COVID-19 and other news across the state of Michigan, go to civiccentertv.com and click on our local news link at the top of the homepage on your computer web browser, and in the left margin drop-down menu on your mobile phone, where you'll find information at the top of the page from the CDC, the MDHHS, and the Oakland County Health Division that links you directly to their COVID-19 specific web pages, so you can keep up to date on everything you need to know about COVID-19 in your community. You can also find stories making headlines on the COVID-19 front and beyond across the state of Michigan from many journalistic outlets all throughout the Great Lakes state. While you're reading those articles in full and their supporting materials, if you have the means to do so, we highly encourage you to subscribe to those publications and support journalism on your local level. CivicCenterTV.com. On our local news page, we post those articles before every single program. We briefly review them at the beginning of the show now that we are a 1 hour program instead of a 2 hour program, as we had been from March of 2020 through the beginning of last week. You can find all those articles in full. For more information, supporting materials, and more, CivicCenterTV.com/local-news. Big thank you to our crew, Jared Clark and Calvin Brown at Master Control, and of course our producer, the king of television, Larry Nyland. That's it for today's show. We'll return Wednesday with a new edition of the Megacast.
This is My Michigan TV, a unique news streaming television network. To watch, simply add our app to your smartphone or smart TV. You can also watch online at mymytv.com. My Michigan TV. My.
Now that the vaccine is available for children 5 and up, why do you recommend it?
Kids are part of the community and they can spread COVID.
We're seeing both healthy children getting sick from the virus as well as children with underlying health conditions.
They can easily bring the virus home to other people that are vulnerable and make them sick as well.
This vaccine can change that and keep children safe.
It's essential that your children get vaccinated to protect them, to protect your families, and to protect those in the community around you.